11 here on Tuesday. Gorgeous sunshiny Tuesday, 39 degrees. And of course, it is Tuesday, and you know what that means. It means it is time for one Mr. Dr. Bob Olivieri. Good morning.
Good morning, Mark. It's good to be here.
Yeah, good to see you. And today we're going to have a really interesting topic. We're going to be talking about stem cell therapy, you tell me, huh?
Yeah, we're really excited about that.
And
it's a new program that we're implementing in our office.
That is really exciting, and I guess one of the things that it can handle is chronic joint pain.
Yeah, pretty much. Yep. We're going to talk about all the different research that's going out with stem cell therapy, and then we're going to talk about some of the services that we're offering in our office.
All right. Well, this is exciting. So let's just jump right on into it.
Yeah. So what we did, Olivieri Chiropractic and Rehabilitation partnered with the Regenerative Medicine of South Jersey to offer stem cell therapy treatment. And so we're extremely excited about this because stem cells are all over the news. So I'll tell you a little bit about my story and how I got interested in it. When I was growing up, I had multiple injuries, due to playing sports.
Right.
I had fractured my lower back and wore out one of my hips and injured both shoulders. And so over the last 3 years, I've had kind of like some difficult times as far as trying to rehab some of that. About 4 years ago, I had 2 different shoulder surgeries, one in each shoulder because I had some calcific tendonitis. Both of those surgeries, no change in the outcome.
Yeah.
I had a hip joint replacement done, and I can absolutely say that I am so much worse after the hip joint surgery than I was prior to the hip joint surgery.
Wow.
Huge mistake.
Yeah.
And I had this fracture in my lower back, and that would give some sciatica, a condition called spondylolisthesis. So over the last 4 years, we've been implementing a whole lot of new procedures in our office, and I think that we've talked about this on the show many times. I think the technology that we offer is unlike anything else anybody else is offering in whole South Jersey. We're using some advanced equipment called PEMF, certain types of laser therapies. We have multiple lasers in our office, 3 different types of lasers. We have a lot of electrical stimulation types of machines, and they've helped. We've implemented spinal decompression. They've all helped, and every one of them helped me quite a bit. But I was looking for some of the ones, especially my hip, which that equipment didn't help. So I was looking for some other outlets, and I've had multiple patients coming in my office, including one of my patients is a medical doctor who had stem cell injections, and he kept on saying, Bob, you really should look into that. And he goes, it's really, it's helped me, and he had to travel really, really, really far to get it. And so I started Googling a little bit and who's offering stem cell therapy, and no one in South Jersey is offering,
Wow.
At least if you go on the internet. I mean, I'm sure there might be a couple offices that do it periodically, but there's nobody that's really doing it full force. So I just said, something? I think that this is a therapy. Like I say, I try to be cutting edge. We've always tried to do that in our office, and everybody's like, why would you do that in Rio Grande, New Jersey? And I said, well, people used to ask me, why did I open up a functional medicine practice in Rio Grande, New Jersey either? People travel, and we get a lot of patients coming from Cherry Hill area all the way up in Atlantic City and Tuckerton area to come down for our protocols that we're using for the lasers and everything. So I said, I really do think that we can make an influence with this stem cell therapy. The nicest thing about this is it's one injection and you're done. So it's not like you're coming back repetitive times, like a lot of our patients are traveling 60, 80, 90 miles every, 3 times a week. So we just said this is a kind of a simple therapy. So we decided to partner with the Regenerative Medicine of South Jersey, and we're going to be offering this. Now this is different for me because I'm going to be functioning as strictly an educator. That's my only role in this program. So I'm not the person giving injections. I'm not the person partaking in any of those things. It's just basically as an educator. So what I want to do this morning as we start to go along is I'm going to talk to you a little bit about what regenerative medicine is and why the therapy that we're offering in our office, even if you have heard of stem cell therapy, I really want you to really, really get a great education on why not all stem cell therapy is the same, and why I've done a lot of research in this, and why what I think we're going to offer is the best.
We're going to educate you here this morning. So this is really exciting stuff. Dr. Bob Olivieri is joining us this morning. Yeah, stem cell therapy. Wow, this is really, really cutting edge stuff. So we'll continue our discussion in just a moment. You are listening to Bob and Mark, Dr. Bob and Mark, good morning. Here on 23 right now, Dr. Bob Olivieri is in. I just never know what we're going to talk about. And man, it's great though, because we're talking cutting edge stuff. This is like, man, this is amazing to me.
That's all right, Mark. I never know what I'm going to be talking about either.
No, but I mean, it's great because, like, who would have thought that, this morning, well, you would have, but I wouldn't have thought that here we're going to be talking about stem cell therapy. We're talking cutting edge stuff here today.
Yeah, we are. We've been gearing up for this for over a year, but I've been keeping it a secret because I really don't, I want to launch this, and we are. Just so you know, we're launching this in all the way from Toms River to Cherry Hill, up through Atlantic City area. So this is a big deal. We have a lot of people coming in for this.
All right, well, I totally believe that, but here's the one thing. You started off, you were having like some hip problems and that. Did you sign yourself up first?
I did. We went out to the training center. I was out in Indianapolis, and so what I did is you had to see the funny thing with stem cells is they don't last very long. So when you order those, you really have like 24 hours. You can go up to 48 hours to really kind of like inject them into the person. And the facility that we use, they're derived very, very recently. So it's a whole process. There's an ordering process. It's very difficult. It doesn't sound difficult. It is. You have to have everything frozen to minus 160 degrees Celsius, and you're dealing with UPS. You're dealing with it. There's a lot to this. However, I did. So I went out to. So I ordered myself 3 cc's of stem cells. So little did I know that I needed absolutely a lot more, probably twice that. So I went out. I had my hip injected, which I can report is 95% better. Now you have to understand this is after a hip joint replacement that failed.
Right.
Okay. So that's important to get that. The hip joint replacement failed, and then I did. My hip is, and every patient that comes in my office knows that I do nothing but complain about it. I mean, it has not been a good experience for me for 2 years. I did it so I could start doing some triathlons, and I was limping up a flight of stairs after a year. So it didn't go well. But that great success with my spondylolisthesis, that particular facility that I was at, their protocol was that you inject the site of most pain in your buttock. To me, that doesn't make sense. It makes sense to go to the actual spine itself and inject. So I had one down in the sciatic place. I would say that's probably 30 to 40% better. And I'm going to tell you what, I mean, this takes 90 days for it to actually, start to grow, stem cells replicate, and we're going to talk about all that. So I'm on my way, but when we start doing it in our office, I'm going to put 2 cc's in my spine because that is the protocol. So I'm going to do that. And then I did one IV. I did an IV push, 1 cc. It should have been 2. And but I didn't have any more. Like you have to pre-order these, and it's extremely important in the protocol that you get it right when you're ordering them. So that was my experience. So overall I felt phenomenal. I felt really, really good because stem cells go to the site that they really need the most repair. So let's talk a little bit. I'm going to talk a little bit about what regenerative medicine is, because that's basically what we're doing, the South Jersey, regenerative medicine of South Jersey. So what is it? Basically, it's the science of living cells being used to potentially regenerate or facilitate the repair of cells damaged by either disease, poor genetics, an injury, or just aging.
Right.
I don't know whether you've ever heard of stem cell therapy, but you can't watch any of those shows that come on at 7 o'clock tonight, like Hollywood shows that are in there. Everybody's getting stem cells from anti-aging types of things to chronic disease. There's a really good video, if you go on YouTube, by Mel Gibson. He talks about his father who was absolutely dying, like 90 years old, and they were, the whole family got called in, and one of the family members said, we want to get him down to Mexico because at that time that's where they were doing him. Right. And he's 99 now, and he's pushing everybody around in the nursing home in wheelchairs, and he was on his deathbed. And basically, it was 2 cc's he did IV with the person. So there's a lot of anecdotal stories, but the reality of it is stem cells are the wave of the future for regeneration. So basically, in medicine right now, we have some current options for joints. We can inject them with some cortisone. We can, use some gel injections, the Halligan or Synvist, which actually acts as a little bit more of a buffer. And then the surgery, and for surgeries, you can repair tendons, you can repair cartilage, and you can do, partial or complete replacements. If you're looking for other answers besides those, because, I sure was, there's other things. In regenerative medicine, it's a whole different concept. Instead of like taking things out, you're basically regrowing it. You're regrowing bones, tendons, cartilage, ligaments, and other tissues. And really, the power that made the body should be able to heal the body. You know, we're always regenerating. Our stomach cells regenerate every 5 days. Our skin cells regenerate every 7 to 10 days. Our red blood cells regenerate every 4 months. Our liver cells regenerate every 5 months. You know, our bones completely regenerate every 10 years. So why not take the power of that and start to use that in the healing process? So we're going to get into that in just a little bit more in a minute.
It makes a lot of sense, and it's fascinating stuff.
It really is.
Let the body kind of heal itself with a little help.
Right, exactly.
Yeah. So Dr. Bob Olivieri is in here, and we'll continue our discussion in just a moment here on the Bob and Mark Show. Oh boy, we're talking a little bit about stem cell therapy, and what are stem cells?
Well, that's a great question, Mark, actually. Basically, when you're talking about stem cells, they are biological cells that can differentiate into other cells and divide and reproduce more of the same type of stem cell. So what's really cool about it is a stem cell, what they call a mesenchymal cell, it's a primitive cell, but it has the ability to reduce inflammation in an area. It will fight apoptosis, which is really cellular death. It can differentiate and turn into other muscle, bone, fat, cartilage, and it can self-replicate. So it basically what it is it's a blank cell. You know, so it can mature into these muscles or tendons or cartilage or even nerve cells, but they're self-regeneration, and they're really driven by inflammation. So what happens to stem cells over a period of time is when you're a newborn, every cell that you produce, about 1 out of every 10,000 cells, is a stem cell. But as you start to age, that number greatly reduces. Even as a teenager, it goes down to 1 out of every 100,000. At the age of 30, it's 1 out of every 250,000. By the age of 50, it's 1 out of every 400,000. By the time you're 80, it's 1 out of every 2 million stem cells. So that's why when you're younger and you fall, boom, you rejuvenate really quick. You know, the muscles repair, the bones heal really fast. And as you start to age, those injuries...
You get older and frailer.
You do. You know, you really do. So that's why the procedure that we use, and we're going to talk about this, are very young stem cells. Mm-hmm. The older procedures out there are not. So let's talk a little bit about some of the stem cell therapies. There is embryonic, there is amniotic fluid, there's placental, there's autologous, which are your own stem cells that you inject back into your body, and there's human umbilical cord. So what happens with this is, like the ones that we actually use are umbilical stem cells. In the United States, the two most commonly used are autologous, which are actually from your body, or they actually come from the umbilical cord. So with autologous, basically what happens is it's a surgical procedure. You go in, they're derived from your own fat or your own bone marrow, and they're really not that potent because, let's face it, the older you get, the less you have, right? So you want to make sure that it's a very good source. They're also very expensive, and they're dependent upon age. With the umbilical cord stem cells, they're from a healthy born baby's, the cells inside of an umbilical cord. Right. And they're also derived from the healthy mother. So there's no potential adverse or allergic reaction. They're completely undifferentiated. They're simple, they're fast, they're very, very simple injections, and they're customizable for each one of the patients. So basically what happens with the process is really interesting. What they do is they decide, a mother at the 7th month of pregnancy decides if she's going to donate her cord and her placenta. So if the mother says that she's going to do that after her cesarean section, what they'll do is they do a full physical exam on the mother. After the baby is delivered, the cord and the placenta are taken to a lab where there's a ton of testing done there. They extract the cells and they freeze them right away, and they're sent off to a facility. So So, and then there's batch tested from the laboratories. So it's extremely, extremely detailed procedure. It's really like I think it's a 12-step procedure,
Right.
but it's to assure you're getting the highest quality and the best stem cells from the umbilical cord. So it's a healthy mother, a healthy baby, and it's donated to science. So you'll hear a lot about this on the news. And the reality of it is the research over there's over 5,300 current worldwide studies, and there's 460 active clinical studies in the United States. So the biggest thing is really looking for credible research. So Dr. Google is not a researcher,
right.
Okay? I always emphasize that.
Yeah.
So you want to go onto a thing called PubMed, PubMed. I live on PubMed. I'm on there at least once a week, sometimes 2-3 times a week. That's where you get the most updated research is available. Or you want to go on to www.clinicaltrials.gov, because that's where you'll get the most updated research on stem cells. That's www.clinicaltrials.gov. So there's a wealth of research that's going on here, and what we're doing is we're staying within the musculoskeletal realm of degenerative arthritis and chronic joint pain, and with knees and shoulders and wrists and elbows and lower back pain and peripheral neuropathy. Some of the things we stay with inside there. So we're staying within the joint realm, but the most recent scientific research that's going on there is all these autoimmune diseases, from chronic lower back pain to lupus to psoriasis to scleroderma, psoriatic arthritis, everything from lung diseases, Parkinson's, Alzheimer's, strokes, Guillain-Barré. So there's a wealth of information that's going on in the scientific community for stem cell research. We're just staying within the areas that we were talking about. And we're going to get back in a minute. We're going to talk about very frequently asked questions that people always ask us about stem cells.
Wonderful. Dr. Bob Olivieri is with us here this morning. We'll continue here in just a moment. Stick around. You're listening to Bob and Mark in the morning. And we're giving lots of information here this morning, too. At 8:53, 42 degrees. At least it's getting warmer. Maybe not as warm as it was yesterday and the day before that, but we'll get to run down the Aggie weather in just a little bit. Right now, though, it is Dr. Olivieri time. He's been talking about some really interesting stuff today. We're talking about stem cell therapy, and I would imagine there are some frequently asked questions.
There are, all the time.
Yeah.
So basically, people are asking me who's performing the injections at our facility. So all therapies, all injections, all IVs are provided at the Regenerative Medicine of South Jersey, are provided by licensed medical professionals required by the state of New Jersey. So every single person that comes in and does the procedures are licensed medical professionals. People ask me, how long does the treatment take? Joint injections take up to 15 minutes. The injection itself just takes half a minute.
Right.
I mean, even shorter than that. A couple seconds. But the timing from that, the IV therapy is usually about 20 or 30 minutes. Both are dependent upon the number of injections that the patient's getting and the amount that's being infused. What are typical results? Well, what we usually see in the group that we're with. About 15 to 20% of reduction of the symptoms within the first 48 hours, no matter how long you've had this pain. That's incredible. 50% of the people, 50% improvement in the first 4 to 8 weeks, and continual results up to a year. But as with a disclaimer I give, as with any medical procedure, there's no guarantee of results.
Right.
Another very frequently asked question is how long do stem cells regenerate? And that's a great question. This is the beauty of this therapy. The stem cells duplicate about every 28 hours for 65 cycles. They continually heal for 65 cycles, which is about 90 days. Okay. So healing can occur about up to about a year to a year and a half. And they're really safe because they've been used in the United States for the last 30 years. The United States Food and Drug Administration approves the stem cell labs and regulates them to ensure that the safety of the cells, as well as they would any other product or medications or blood products. And stem cells do not contain any DNA or blood. That's important. Right. So you don't have to worry about typing or crossing at all. Is more than one treatment needed is a really common question. Based on previous research, most people need only one treatment. and have the option for maintenance dosages, let's say in 3 to 6. So let's just say if the recommended dosage had to do with some body weight and you were between the two. And after about 6 months, if you say, you know, I'm like 90% better,
Right.
but I want to get a booster, you can. One of the other questions, does insurance cover it? It does not. Insurance does not cover any part of that. Are any potential side effects? Basically, as with any injection, there might be some slight discomfort at the injection site. For most people, that's not going to occur. There can be an occasional mild flu-like symptoms after the injection, or on rare occasions, a patient may experience an increase in intensity in the symptoms. So if you get a joint injection and there's a ton of inflammation inside there, it's a good thing. It's telling you that the stem cells are actually working. It's recommended that you'll take some type of an anti-inflammatory to kind of like decrease that, something over the counter. But that's discussed with you and the provider that's actually doing the injections. Do injections hurt? Absolutely not. The area is treated and cleaned and then sprayed with cold spray. They numb the area. You might feel some pressure, but you shouldn't feel the needle. I hate needles. I cannot stand needles. And I will tell you, it was painless when I got mine done.
Right.
So what are some of the pre and post care directions? 5 days before, you have to you can't take any steroids or anti-inflammatories, no fish oil, statins, vitamin E, turmeric, anything that's going to decrease inflammation, because stem cells are driven to go to the inflammation.
Right.
And 3 weeks after, same exact thing. No alcohol, avoid carbs and sugars, no anti-inflammatories. What are post-activity restrictions? That's one of the questions. For the first 2 days, you got to relax. Don't use any heat. Don't use any ice. Take it easy. From day 3 to day 14, you can restart any of the activities that were previously routine, just routine, like riding bikes and doing that type of stuff. But don't start any new exercise program.
Right.
Let's just say, like if you sprain your ankle and you had your knee injected, guess where the stem cells are going to go?
Yeah.
Down to your ankle, right? They follow inflammation. So
Right.
after day 15, it's important to start some type of a therapy program, because you want to learn how to reuse your muscles and tendons that you really haven't been doing. There's a few more points. The body determines where the stem cells go. They go to the areas of the body where the inflammation and the parts are most desperate in need of repairing and regenerating. Stem cells do not cure any disease. That's not what they're designed to do. Okay, so this is a transplant, right? This is not medicine. So that's pretty much extremely important for you to kind of understand that. So that's most of the questions that we get. So what we do is we hold seminars in our office, and there's going to be one on tomorrow at I believe it's 1 o'clock,
Okay.
and Thursday night at 7 o'clock. And we're going to be doing these throughout. So you'll see it in all the newspapers. We have it here on our radio here. But call to our office at 886-8585 if you want to come to one of the workshops to learn more about these stem cell therapies. It's really important that you sign up. I will tell you that every single workshop that we've had standing room only, and now we're really limiting it we're trying to keep it to under 20 people. So it's really important. If you're interested in this new technology, you want to learn more about it, just call our office at 886-8585, and we should be able to cover it all.
All right, Olivieri Chiropractic and Rehabilitation, located right there on Route 47 in Rio Grande. Once again, that number 609-886-8585, OlivieriChiropractic.com. As always, thank you so much.
Thanks for having me on, Mark.
Exciting stuff today. We will be back.